Good afternoon, team. Otieno, confirm you can hear me.
Yes, I can hear you, Songok. I can hear you.
All right, thank you. Thank you, Otieno, for confirming that. Good afternoon, team. My name is Franklin Songok from NASCOP. I can see we are still few. I want to request that we take a few minutes to mobilize our other colleagues to join. And we can purpose to begin at 10 past, Otieno. Would that be a good time to start?
Yeah, I think that's fine, Songok.
Okay, thank you. So meanwhile, let's take about 7 to 8 minutes to mobilize our other colleagues to join the call. Then we can begin at 10 minutes past 2. I can see we're still quite few. We're about slightly above 160. So let's take a few minutes to mobilize our colleagues. Then we begin at 10 past. These are very important webinar, and would really wish that we have a good number of end users and, of course, managers joining. Thank you. Great. Good afternoon once more. Otieno, I think we have quorum. We can begin without spending much more time. The rest of the team members should be able to join us. Otieno, confirm whether we can go ahead. I can see we have a good quorum. We're about slightly above 400.
Yeah, Songok, I think we can proceed.
Yeah, sure, because of time. Yeah, so because we have a lot to cover. Yeah, so once more, let me take this opportunity to welcome all of us to this virtual training. Like I'd mentioned earlier, my name is Franklin Songok. Today we will be introducing to you TaifaCare version 19.2.0, which marks a great significance in terms of the journey that we've traveled in ensuring that we align with the digital agenda as laid out by the ministry, and that it's an official milestone in terms of rebranding of KenyaEMR 3.x in compliance with the laid down rules by the ministry, and of course by extension to expand to a patient-centric digital health implementation, and of course the digital health agencies guidelines, just like I'd mentioned earlier. So I think you've already seen, for those who are currently utilizing TaifaCare, TaifaCare is powered by KenyaEMR, and in our previous meetings, I think we had mentioned that currently the ministry has approved 3 EMRs to be rolled out across our facilities. That's today we'll be talking about TaifaCare powered by KenyaEMR, which remains customized distribution in as far as global OpenMRS platform is concerned. Some of the key highlights that we'll be touching on today is issues around integration features. We'll also be able to share with you information exchange platform for national shared resources. We'll also be able to talk about ICD-11 terminologies, and of course, some of the enhances that have been made to ease the system performance in terms of managing our clients, and of course, making sure that you are able to resolve or fix any bugs that may arise and strengthen stability of the system. So having said that, that is just a preamble. I want to kindly request if we could have one person to lead us in out of prayer. Moses Care, I don't know whether you're in a position to just say a short prayer as we begin.
Good afternoon, Songok. Please confirm that you can hear me.
Loud and clear, Moses. Go ahead.
I'll gladly offer a prayer. So let us believe and pray. Father, in the mighty name of Jesus Christ, we thank you for this opportunity that you brought us together as the HIS family, drawn from the different parts of this country. Lord, we are here to gather knowledge on how we are going to improve on the services that you're offering to your people. May you open our inner ears, and may you ensure that the presenters of the day will be able to deliver and speak to us directly. I pray this short prayer, trusting and believing in your Son Jesus' name. Amen.
All right. Thank you. Thank you very, very much, Moses, for the word of prayer. Allow me to share the agenda for the day. Then after that, I will call upon a few colleagues who are here to make a few remarks before we begin to lay the ground for what we expect to come up in our presentation and of course in our demo. So just give me a minute to share so that I can share the agenda. So give me a second. All right. It is one. All right. Somebody confirm you can see the agenda. Otieno or Moses?
Your agenda is up, Songok.
Thank you very much. So kindly note that this virtual training has been organized in collaboration between MOH, of course, through NASCOP, and HIS partners, of course, including the county teams, and it's as a result of the feedback that we've been receiving from your end. So our theme today is towards making healthcare management efficient, of course, using technology. Our key objective today is to officially launch, just like I've mentioned, and sensitize all the stakeholders on the rebranded version of KenyaEMR 3.x, currently referred to as TaifaCare. We should also be able to take you through a demo illustrating the specific features and integration utilities which have been incorporated in TaifaCare version of KenyaEMR, which is aligned to the DHA requirements. DHA in this case is the Digital Health Authority. And we should also be able to highlight some of the enhancements and additional dashboards in the reimagined version of National Data Warehouse. And I think at this point we'll also be able to touch on the surveillance dashboards that have been enhanced within the National Data Warehouse. And finally, we should also be able to provide some guidance on the facility upgrade and what is our support plan in ensuring that all the EMR sites are upgraded to 19.2.0 version of KenyaEMR 3.x. So our intention basically is just to take you through first a presentation, just to prepare you for the demo. The presentations will touch on TaifaCare highlights, the features, the enhancements, the bug fixes, of course, including the DWAPI updates, because this is in ensuring that all the data that we are collecting is also available for consumption or for program monitoring at the national level. And we'll also be able to take you through the real-time facility case surveillance dashboards. And we should also be able to catch up on some implementation updates. So Rajab will start us off. Once Rajab is done, he will be able to usher in Evans Nyaencha. We will also be able to take us through some sections of the presentation. After Evans, I think Rajab should also step in to take us a short one on the slides, and then Rajab will welcome Agnes, and Mary Ann Mwangi should be able to wrap that section up. For the demo, again, just touching on what the presenters will have taken us through. Eric Mudomi and Agnes, Agnes will be able to focus majorly on the case surveillance on the real-time case surveillance dashboard for public health response. So Agnes will touch on that, and Eric will take us through the features that have been enhanced within the EMR. After that, we'll then open it up for Q&A. And at this point, I want to mention that we have a team which is available to respond to any questions. So as the presenters or as the demo is being as we're being taken through the demo, if you have any questions, you can always post on the chat. We have a team of colleagues from NASCOP and from Palladium, and of course other HIS partners who can also be able to respond to any of the questions that that you may have. However, we'll also be able to give you an opportunity to ask any questions. Probably if you have any areas that you feel that you need clarifications on, you should also be able to give you an opportunity to ask, to verbalize your questions, and the team will also be very much available to respond. So I'll be able to step in to moderate the Q&A, the Q&A session. Rosa Yugi will step in for Dr. Lily, who may not be able to join us today. She'll also be able to just take us through our next steps after this webinar. What do we expect from our service delivery partners, from our county teams, and all the other players in this HIS space? So having said that, allow me to welcome a few colleagues to make very quick remarks before we begin our first presentation. I think I've already done the session 1, just looking at probably I'll just take a step back and take you through the objectives, though I've already mentioned them up here. So the housekeeping bit, I think I've already touched on that. Just keep your mics off. The beauty is that we've allowed only the presenters for now to be able to speak. But when the Q&A session, when we're on the Q&A session, we'll ask you to raise your hand and we will allow you to speak. So the admins will give you the mic, or will give you the opportunity to be able to speak. So at this point, allow me to, I don't know whether Otieno confirm, I don't know whether Dr. Jacob managed to join, or George Owiso, to make some quick remarks, and then I'll call upon the agency reps to also make some quick remarks before I call in the county teams. So I don't know, Dr. Jacob, I don't know whether you're in the call. I'm not able to see all the presenters. Otieno, confirm if Dr. Jacob or George is in.
Yes, Dr. Jacob is in.
All right. So Doc, maybe a minute or two on behalf of the Palladium team.
Yeah, good afternoon, everyone. I will not say much at this point. It's just to welcome you to the meeting. We are always committed to supporting, continuous improvement of the system to meet your needs as users, but also to comply with the guidance that we are given by NASCOP, but also the Ministry of Health and the Digital Health Agency in how the systems evolved. And we also, alive to the realities of the changes going on in the digital health space. So this webinar for me is an important one that will allow us to start making a shift, that the much needed shifts that will align us with the value proposition that the DHA is setting up, but also to comply with their guidance. So additionally, then I think there's the data value of the digital health systems in supporting the HIV response. So the case surveillance features that you'll be seeing will be important for the program to continuously monitor the HIV epidemic, but also to respond quickly whenever there are gaps that need urgent attention. So I once again thank the organizers, but also to look forward to a productive webinar. Songok, back to you.
Thank you very much, Dr. Jacob, for your remarks. Without wasting much time, I want to request our other colleagues to also just make a few remarks before we begin. I don't know whether we have anyone from USAID in the call. Kindly raise your hand so that we can give you the mic. Anyone from USAID? Yes, Doc, I can see you. Otieno, kindly allow Dunstan Ajoga to make his remarks. And then meanwhile, we can also have someone from DOD. I don't know that Dr. Gonza is in the call. And then I think I can see Maangi and Sasi. We can also give them an opportunity to speak. Doc, you can go ahead and unmute.
Yeah, thank you, Dr. Songok, and really thanking all the stakeholders, thanking NASCOP, Palladium, for the opportunity to invite us and our IPs to this sensitization meeting for TaifaCare 19.2. We are all excited to be a part of this improvement journey to ensure that we improve the experience of our healthcare workers, especially the data capture and the new modules that align us to the national strategy. As you may all be aware, USAID is going through some transitions, but our IPs remain engaged, and we'll be at hand and continue to diligently implement these new modifications and updates as required by the national standard. So once again, just thanking you and reiterating our commitment in this journey from USAID. Thanks, and back to you.
Thank you, Doc. And we do appreciate the support that we do continuously get from your end, and of course from all the service delivery partners that are supported through the USAID. Next, I don't know whether Gonza is in or Dr. Maswai. Jonah, you can raise your hand. We'll give you the mic. All right. Probably they haven't joined. We'll give them an opportunity to make a few remarks before we end. CDC, I think I'd seen Mangi and Dr. Sass in the call. Maybe you can raise your hand so that we can allow you to the mic. Oh yeah, there's Angelina. Sorry, I hope I got that correctly. So let's, oh, all right. The hand is down again. Okay. Mangi, I don't know whether you're on the call, or Sasi. Yes, thank you. Otieno, you can allow Mangi to speak on behalf of CDC. Mangi, you can go ahead. You have the mic now.
Thanks, Songok. Actually, I wanted to hand over to Sashi, but maybe she can come in. But maybe quickly, just really to appreciate the Palladium team, NASCOP team, and the partners that are really using KenyaEMR. I think without the partners, we wouldn't have made this milestone. So the continuous feedback that you provide has been very useful in ensuring that KenyaEMR is meeting the needs of our healthcare workers. So let me just hand it over to Sashi. Maybe she has a word or two. Thank you.
Thanks, Daniel. I don't know whether Dr. Sashi is in the call. Sashi. Sashi in the call. Yeah, a quick announcement. And meanwhile, as I make this announcement, I want to request, I don't know whether Kate Mbaire joined or anyone from the PCO. And Rose Ayuki from NASCOP, you can also raise your hand so that you can be given the mic. One quick announcement, I've noticed that we've already hit our limit. So we have a YouTube channel that you can always access this particular training. So I'll be asking Otieno to post on the wall, and we've also shared using the mailing list that we had used earlier to communicate to you or share the initial link. Apologies for that. Those are some of the technology hiccups that we normally go through. So we've hit our maximum, but however, that doesn't stop us from accessing this particular training. Thanks, Otieno. Otieno has shared the YouTube channel or the YouTube link, so we can share with the other colleagues who've not been able to join because we've hit our maximum, so that they can join through the YouTube link. All right. So anyone from PCO? All right, so at this point, I want to request, I don't know whether Kiambua Thomas, CHRIO from Kajiado, managed to join, or anyone, any CHRIO who is in the call. I can see quite a number in the call, but I would request one of you to speak on behalf of the CHRIOs, because you play a very key role in terms of ensuring that our digital health conversation is scaled up. Any CHRIO in the call who can speak on behalf of the CHRIOs? I don't want to call any names because I can see you're quite a number in the call. Kindly raise your hand. Okay. All right. Dixon, if you're in the call, you can raise your hand. You can speak on behalf of the county teams. Yes, thank you. Otieno, kindly allow Dixon, give Dixon the mic to speak on behalf of the county teams. Yes, Dixon, you can go ahead. You have the mic now.
Thank you, Songok. Confirm if I'm audible enough.
Loud and clear. Proceed.
Thank you. So my name is Dixon Kaskonarok, and on behalf of the counties, I've seen a lot of county teams who have joined, and we are really glad and we appreciate this opportunity. I know as a country, this is an important milestone in terms of the expansion of matters digital health as part of the DHA requirements. So, and we are far much optimistic as counties that this will be able to sort major challenges that for long has been impeding proper decision making as a country. And TaifaCare 19.2, I think this is an exciting experience that we are here to learn and ensure that as counties we will be able to be part of this journey to ensure that we align to the ministry's requirement. Lastly is to thank partners, especially Palladium and all the other donors and the Ministry at Large, NASCOP, for this far we have come. So thank you, and back to you.
Thank you very much, Dixon, for your remarks. At this point, I want to welcome Rosa Yuge to speak on behalf of MOH, on behalf of NASCOP, and also on behalf of the SI team. I can see Otieno. You can allow Rose to speak. Hand is up. Yes, Rose, you can go ahead. You have the mic now. Over to you.
Thank you so much, Songok. I believe you can hear me.
Yes, you're loud and clear, Rose. Proceed.
Awesome. Thank you so much for starting us off. And I just want to first just to repeat my name. My name is Rosa Yugi. I work at NASCOP, Strategic Information. Now, on behalf of NASCOP leadership, that is the head NASCOP and most of the SI lead, Dr. Lily Nyaga, I would really want to thank all that have been able to get the opportunity to join this meeting today, and really welcome you. I really want to thank the users of the system, and I can see really counties, facilities have joined in their numbers, and we really do appreciate. We also want to thank our partners and most of the leadership for their unwavering support in the journey of the SI, and just making sure that our systems are functioning and very operational. Also really want to thank the county teams who are here, and especially the CASCOs and the HRIOs who've been with us in this journey and really helping us to support the facility teams who are the users of the system. Now, Songok had mentioned that the KenyaEMR has been rebranded to TaifaCare, and I know majority of us are still struggling with that, and a lot has been done since its inception, that is TaifaCare, just to align to the national strategy and to make sure that our former KenyaEMR, which is TaifaCare now, is really patient-centric. That is really a plus to us. I know a lot has been done, additional features and upgrades has been done to TaifaCare, and I really want to take this opportunity specifically to really appreciate the Palladium team. I know it has not been easy, and they've really been working around the clock to just ensure that our users are comfortable and our system is operating optimally. So we really do want to appreciate
Rose, if you're speaking, you're on mute.
Sorry, I don't know where I went on mute, but I think I say that we really do appreciate our partner Palladium specifically for supporting this journey since the inception of the branded KenyaEMR, that is TaifaCare. And a lot has been, a lot of upgrades and enhancements have been done. And I was just saying that it is important as users and managers that we be abreast with these changes, because it's only through this that we can be able to optimally make use and get the best out of the system. We are committed together with our partners to build capacities for data capture, analysis, and use. And I believe even in this meeting, we'll be able to still see the enhancements in those 3 areas. So I don't have much, but I hope this session will be very interactive, and we'll be able to ask questions and on chat and also verbally, so that we are more competent than we were. So without saying much, Franklin, allow me to give you back the mic. Thank you and welcome all.
Thank you, Rose. And I hope you'll also be available at the end of the call so that you can officially launch. Remember, one of the objectives is to launch TaifaCare. So you will virtually cut the ribbon. I hope, Otieno, you are prepared for the fanfare virtually. Thanks, Rose. And we really appreciate the support, and of course, working closely with the other members, the leadership in SI. Right. So at this point then, allow me to welcome Rajab and team. So Rajab, like I mentioned, will take us through the first part, just looking at the release highlights. He'll also be able to talk about the HIE components and the shared utilities. And once he's done with the first part, he'll be able to welcome Evans, who will take us through some bits and pieces of the presentation. I really don't want to go through the highlights, but they'll be able to give us more details on the same. So probably maybe you can just push to session 1, because I think this first part, the preliminaries, I've already done that. So just go to session 1, push to session 1. Again, next, just go to session 1. Yes, at that point. So I think, Rajab, you can pick it up from there. Thank you. And over to you. Once you're done, you can usher in the next presenter. Thank you. And you're most welcome.
Thank you, Sangok, and good afternoon, everyone. Really want to start by appreciating everyone who's joined the call for this awesome session, whereby we'll be taking you through the new KenyaEMR flavor known as TaifaCare. We have some awesome features packed in, so sit in and we have a good session. Thanks. So to start us off with the new version of KenyaEMR, which is called the TaifaCare flavor. So some of the changes that you will notice once you upgrade to this particular version is, 1, on the login page. So as you can see, there are some changes. As you can see, we have the TaifaCare logo there. And then we have it marked as powered by KenyaEMR, which is a distribution of the OpenMRS. Yeah, so basically, once you upgrade, this is what you will find in KenyaEMR. Username password remains to be the same. Next. So what are some of the components that we expected to have in this particular version of TaifaCare? So the main component that we have is the HIE component and shared utilities. So what I mean by HIE basically is the health information exchange, whereby all systems will be interacting with each other through this platform. And TaifaCare version of KenyaEMR has been optimized and integrated so that it can work very well with the shared national health record utilities, which basically is the HIE. So with this HIE intervention, what are we able to get? So one of the things that we'll have with this HIE version is the integration. That is, we will be able to pull patient information from the client registry, which is in the HIE. We will also be able to integrate KenyaEMR with the healthcare providers registry through the HIE, whereby we'll be able to pull provider information and licensing status and confirm whether they are active or inactive. we will also be able to pull the hospital information from the HIE just to ensure that to confirm if the hospital has been contracted by the SHA or rather DHA to be able to provide services for our clients. And also another thing that has been put in place is the data security component of it, whereby any information pulled or rather being transacted from KenyaEMR and exchanged across the other systems, one will be required to use an OTP feature, which basically ensures data security and conforms to the National Data Security Act. Then some of the things that we have under the HIE shared utilities, as I've mentioned, one is the client registry, whereby we will be able to pull the client information, rather shared client information from the registry. The other thing is the health workers registry, which basically enables the system to pull records of the health worker, that is their status, licensing status, the registration number, and such. Then we also have the Kenya Health Facility Registry, which ideally captures the facility information as is in the Health Facility Registry to just confirm whether the site has been registered under SHA or contracted under SHA. Then we also have the eClaims, which is the electronic claims management service. So with the latest version of TaifaCare, the facilities will be able to do direct eClaims from KenyaEMR to the claims service, which ideally is a plus. And then we also have integration to the Kenya National Health Terminology Services. In other terms, we call them the ICD-11 codes, which is being used nationally, so that's to enable claim the claim functionality work seamless. And lastly is the national shared health records, whereby KenyaEMR, rather TaifaCare, will be exchanging information across with the other systems seamlessly. Yeah. Next slide, please. So on the next other slide, so we have now the roadmap, or rather how this HIE functionality will work. So we have the Kenya Digital Health Superhighway, which ideally is the HIE superhighway, whereby all the systems will be interacting with each other. And some of the components that we have here, for example, there's the use of USSD, SMS, mobile app, web app, as the KenyaEMR is, and national analytics and intelligence, public health reporting. These are some of the components that we'll have, which we will be able to also assist in the case surveillance. Then another component that I want to maybe emphasize on is the National Health Information Exchange, whereby we have the client registry. We have the Kenya Health Worker Registry, Kenya Health Facility Registry, and all the rest. So all these are being compounded into the HIE, whereby it will provide an interface for all the other systems to interact with each other and ensure seamless integration and data exchange across all the other systems. So in terms of security, as we have the information security services. We have different layers to support this. So we have the servers, we have the internet connectivity, we have the National Health Data Bank channels, and the likes. So what is being emphasized here preferably is the use of OTP, or other biometrics, to ensure that data exchange across all these various systems is actually done securely, and no unauthorized access to this data will be allowed. So basically, through this particular integration feature, we ensure security and exchange of data seamlessly across all the other systems. Yeah. Next, please. So next, I want to focus mainly on the eClaims management, which is a big feature that has been incorporated into the TaifaCare release. So the TaifaCare flavor of KenyaEMR basically has the eClaims module, which will make the process seamless in terms of submission, tracking, and management of the health insurance claims, which will be done electronically, and thereby removing or reducing the use of paperwork and avoiding the back and forth that we usually have in terms of claims. So some of the key features that we have in this particular that this model will bring is one is the digital claims. So claims will be pushed digitally from KenyaEMR to SHA. So I think this is one of the biggest feature. 2, we have the automated validation of patient eligibility. So once a client has been entered into the KenyaEMR, data synchronized seamlessly with HIE, you should be able to get a status of the patient SHA eligibility. So you can see whether it's active or inactive. And from there, you will know if this client basically is eligible for these services. Then we have the integrated within systems workflow for seamless data flow. This is through the HIE feature that we had said. So KenyaEMR basically will be integrated with all the other registries to ensure a seamless workflow when it comes to doing now claims, so that we reduce the back and forth. And then the other part of it is now on the benefits. So what are some of the benefits that we'll have? One of them is faster claim processing, whereby it will reduce the number of rejections. For example, you see, once you validate a clinician or rather a health worker through the HIE interface, this will reduce the number of rejections which usually come through a provider not being licensed or some of the things. So e-claims. So this e-claims feature will be able to mitigate that. Then improved revenue cycle management for facilities whereby they can be able to see the revenue collection through the dashboard that will be provided, and it will be an instant feature. Then enhanced transparency and accountability when it comes to claims again. So basically everything will be done electronically. So this will aid in transparency, and then support universal health coverage in terms of the UHC goals that are mandated by the government, whereby all patients will be able to be given service at the facility based on their SHA eligibility status. Yeah, thanks. And next. Yeah, so just to expound more on the functionality of the e-claims module feature. So this is a snapshot of how the system basically works. So on the first bit is on the payment mode, whereby once the payment has been marked as being done through the insurance, you should be able to see the icon to basically enable you to process claim. And one of the things that will be done here first is if I click on process claims, it will take me to the pre-auth request, whereby first of all, the claim will be submitted for pre-auth. Then after that, when you navigate to the dashboard, you should be able to see the status of your claim, maybe the claim status update, whether it has been authorized or whether it's still pending. Yeah, so you can be able to track the status from there. And then based on the status, if a submission is required or rather resubmission of returned claims, you should be able to also see from there and make the correct amendments and resubmit the claims from there. Then the other bit of it is now the claims history, whereby at a glance, you can be able to see the history of your claims over a period of time, those that have been rejected, those that went through successfully, so that to enable you, maybe if you want to make an intervention, you can be able from there to do it from there, and maybe do proper tracking as well from the dashboard. Yeah, so these are some of the functionalities that we have on the claims modules features. Next. So on this bit, if you'll allow me to call upon my colleague at Evans to just take you through some of the release highlights that have been bundled with this new TaifaCare flavor. Thanks, and over to you, Evans.
Good. Thank you so much, Rajab. Good afternoon, everyone. I'm Evans Nyaencha, and I'll be taking you through the key highlights of TaifaCare, since you have rebranded it. So I think today, majorly, I'm going to cover the major improvements, the enhancements, bug fixes, and this is that are including the significance, maybe the requests that have come from our users. So I think this release focuses on the system stability. We talk of the data integrity and user experience, improving the across all modules. that will directly benefit our or your daily health workflow. So to begin with, I think I'm going straight to the release highlights. That is a continuation. I think Rajab has covered one bit. That is the official branding. So I think the next thing is for you to maybe to make sure that you are in the. So apart from checking on the rebranding, you can see which version you are specific. So if we go to the under modules and system info, so you're going to see the version that is 19.0.2, 19.2.0, which represent a significant milestone as a tailored distribution of OpenMRS, specifically customized for health facilities in our region. So I think you can talk of the major updates. So this release includes over 28. That is 28 and more. There's a lot of gone through this release, enhancements and critical bug fixes that address users' feedback and improvements system performance across all modules. So for compatibility, I think this version is fully compatible with the OpenMRS that we have said above there, the distribution 2.6.15, and also not forget of the MySQL 8, and also the DWAPI version is going to change. So if you upgraded to this newer TaifaCare, then you have to update your DWAPI to ensure the seamless integration with the existing infrastructure. So for the newer version, we are supposed to have the 3.1.40. So for performance focus, I think this release emphasizes on enhanced system stability, to improve the usability and maybe the stronger interoperability between the different healthcare modules, as Rajab has shared above there, the healthcare modules. So the key areas that we're going to focus today, this is the improvement of the improvement of the span. So we have the 4 critical areas. That is the case surveillance for better disease monitoring. We have commodity management for efficient inventory control, and also we have the clinical forms. That is for streamlining data entry, and not forgetting the enhanced reporting capability so that we can consume our data and very well. So you can go to the next slide, please. So I think I'm going to talk about the features specific. That's what I've given up there as a highlight. So the first bit, I think, is case surveillance. So what is case surveillance? This is a real-time data transmission. Capabilities are maybe allow the cases surveillance data to flow seamless to dashboards like we have the above site level. This enable, I think this one enable public health officials to monitor diseases, patterns, outbreaks in real time for faster response and coordination. So next, I think we can talk about this commodity. So I did commodity, the word FIFO means first in, first out. That is to say, so the stock management system ensures that medication and supply with the shortest expiry date are dispensed fast, and significantly reducing the wastage and to ensure patients receive the freshest medication. So if we talk about the clinical workflow, so I think we have a major improvement on that, specifically on the RDE, that is retrospective data entry functionality, is now available and allowing healthcare workers to enter historical data for forms, labs, medication, and making it easier to maintain the complete patient record. So in terms of role-based, this release is enhanced with the security framework with the improved user permissions, management to ensure healthcare workers only access functions and data relevant to their roles, maintaining the patient's that is patient confidentiality. So if you talk about the reporting, so I think we have added new MOH registers significant to improve the data accuracy across all the reports, providing more reliable data for decision making and compliance with national health information requirements. So this one I'm going to see them later. So if we go talk about the interoperability, that's the layer. So this is an enhanced integration capabilities, I think, with the national health system, making it easier to share data with the all across all system, as Rajab has shared the platform up there. So I think for user experience, this one is not supposed to forget, because this is the core. So this one has streamlined the interface across the system and improved from validation, making the system more and reduce the data errors during entry. So if you can go to the next slide, please. So I think we are done with the we are done with the TaifaCare, the highlights. So let's go specifically on the key enhancement, of which we're going to cover what I've just said above there, most of it. So this is the key enhancement and bug fixes that maybe that have been requests from our users. So we're going to show them what we have handled and what is going to be on the release. So the first part I think I'm going to talk is on the retrospective data entry. I've just mentioned up there. So we are going to see the enhancement, the prescription, the workflow, the drug billing, and so. So I think if you can go to the next slide, please. So to beginning, I think is the retrospective data entry. This one, I think we had an issue on maybe on how to handle the past record. So I think we have made a major improve on that. So we have the first section that we normally know. So the new is the person who is currently at care, the current patient that is in the room. And then if you go to the next is ongoing. This is a visit and maybe started. Maybe the system wasn't there, or maybe there was an issue, but the client is on going on the visit. So this one you can start it. Then you can take this time back when the client started visit and then when the visit end, then it's going to be ended. But on past, this is where the RDE works well. So this one you need to provide the start date, the client, the time that the patient came in, and also you have to provide the time at the when the patient the visit was ended. So this one you should be careful. So it might be the same date. This is the start date, but the time you should be careful on this. So for example, here we have 7:04, and this one is 7:04 still. So this one you need to adjust on the time. If the patient took 20 minutes, then you have to change this one to 7:24. I think that's clear. So if we go to the next thing. So I think we have also, I've said we have done on both the forms and lab test and drugs. So if you can see now, if you want to do a test, if you want to enter the test that was maybe ordered previous dates, so you have a privilege, or you provided a tab where you're going to add the order date. So this one you can put the past date, but this date should conform to the visit that person came to the facility. So you need to check or maybe select that visit that person came. So this applies for both the lab test and the drugs, and also the non-pharmacist items. So if you can go to the next slide, please. So without forgetting, I think this one was a big request from the pharmacist. So this is a significant improvement for pharmacy team. Pharmacists can now modify prescription directly in the system, including changing quantities, dispensing, adjusting duration, and when maybe clinically needed to be adjusted. So I think you can see the first section. So the first section is we have the modify. So the first picture above. So this is to modify. So means for this one, so before you dispense, you can modify this one. Maybe he was given more. Maybe he was given 10, but what is available on the pharmacy side, it is 5. So you are able to adjust that one, and maybe you can prescribe again for the next, maybe for that patient to come for the next again after that 5 have ended. So for the next picture down there, so this one you cannot modify if you don't have the active visit. So you need to check in the visit. So this one, if you click that visit to modify, it will ask you whether you want to create a new visit, or maybe you want to use the previous visit, or the visit that has been ended during this order that was requested. So you can go to the next slide, please. So moving to the next slide, I think this is also the major request from the pharmacist. So this system now initiates billing direct from the pharmacist module to ensure more efficient client flow and reduce waiting time. So I think this one was requested since you might find the clinician has ordered the drugs and the drugs has bill there. So you might find the client has bill, but when maybe he or she goes to the pharmacist, is being told there's no drug today, maybe we print for you to come tomorrow. So that's to avoid that one. So we have allowed the billing to be done on the pharmacy side. So the patient has to go and confirm from the pharmacist, is there the drug? Yes. So if it's there, and then the pharmacy can initiate the bill, and the patient can go back to the cashier and settle. Or the other bit, if the drug is not there in the store, so the pharmacist also has a privilege or as a tab here to print the prescription and give it to the patient to go maybe buy or maybe get from somewhere. You can go to the next slide, please. So without forgetting, so we have the ICD code integration. So this one has been all clinical encounters form now support ICD-11 coding standards. This to ensuring the compliance with the international classification system. And then the improving data quality. So you can see all the drugs now as code, the codes that start, and then the name of the diagnosis or the need itself. So if you can go to next slide, please. So without forgetting, I think that there are some things that are being requested mostly from the facility. This is one of it was the HIV risk score. So you might find the facility were maybe on the previous version were generating the scores. Yes, they are visible on the format, but upon saving, if you go to access on the report, you would find them. So now if you upgrade to the latest version, this one has been sorted. You are going to have the correct data for that record. I think this one, this part case surveillance and reporting is a major part. So for case surveillance, I think I'm not going to share some screenshot here because the next presenter is going to share some of the screenshot for the same. But I'll have to talk about maybe a bit. All right. So this is a real-time case surveillance. That one, that's the data transmission now works seamlessly. That is, we have talked about the above side, the allowing the county and national official to monitor diseases and patterns as they are happening. So I think this one I'm going to be talking more about on the next slide, please. I think the next slide is on the maybe providing the what is necessary for pharmacists. You know, sometimes the pharmacists may need to confirm some of the diagnosis, the lab tests that done that one, the vitals, maybe the drug conform with the weight, certain drug need to be not given to a certain age. So this one has been provided in detail. So when you go to the prescription, I think the prescription part, you're going to see the name, the age, and you're going to see the weight part. But this one I've covered the condition part, which is a necessary part. So this is a diagnosis. You're going to see maybe the condition that person, what he or she has. Next slide, please. This is still a continuation. So I think this is talking about the commodity. So to be specific, let me talk about the commodity because this is what major improvement and also enhancement has been on this. So I think I've talked about the FIFO. The system now automatically dispenses the item that shortest expiry date first, and then so this one, I think this work seamlessly across various stock scenario and significantly reduce the medication wastage as I said above there. So I think the next thing I can talk about is the stock enhancement and the operation. So you can now perform both a positive and negative stock adjustment with the proper documentation, or that is the auditing trails and making stock reconciliation for more accurate and transparency. I think this one we had a gap on that one for negative and positive adjustment. So this is made possible in this release. So I think for the other thing we have done is we have increased maybe for improved batch management, we have increased the column width for the batch number and improved expiry date ordering. So making it easier to identify and select the correct batch during dispensing. When maybe somebody needs to see the certain batch number, that's I want to dispense this one, even though it has an expiry date of the. So you have an option that you can choose, but it's arranged well according to the expiry date from the late one near to expire and then the like that. So next, I think we are going to talk about the fixed price issue. I think we had a critical fixed issue, that is a purchasing price. Now are properly separated from the dispensing price, preventing the price you paid for medication from the appearing as the patient charge. So I think that one is catered well. So for clinician access, I think this was a most complaint. So doctors and clinic officer now have a real-time access to stock balance while prescribing medication and preventing prescription from out-of-stock item. So if you can go next to the next slide, please. So I think I'm going to talk about the new MOH registers. So I think we have covered some of them here. So I think the mostly if you can access, I think we're going to share that one on how to read more and what have been added in terms of the report. But let me talk about the MOH 240. So this is a lab register. It's now available for facility wider laboratory. So reporting and make it easier to track our laboratory activities. So the other register is for 16. That is an eye register. There's support comprehensive eye care and documentation for reporting. So the other MOH report that have been added is a therapeutic and pre-summary. This is available for pediatric department and also rehabilitation services. So I think without forgetting, so we have some critical reporting fixes at a lot that we have done, but I can talk about it for the main report, that is the MOH7 that one, and not properly populating HIV positive testing results. This has been fixed. The problem with the active on art line list with including CD4 count display and appointment date accuracy is a lot that I've gone through that one. So all improvements above ensure liability data for healthcare decision making and also maintaining compliance with the national health as information requirement. So I think to conclude with that, so I think to call to action, we have for complete technical detail. I think we have if you go to the release itself, you can going to find an e-health release note. It has covered a lot. So if you want more detail of what has gone through in this release, you can access that one under our Palladium Git. So I think that is it. I can usher in Agnes to continue from there. Thank you.
Thanks, Evans. Thank you, Evans. I think I'll come in next as Agnes prepares just to complete on this section and then go through DWAPI. Then Agnes will come in with the data warehouse. So thanks, Evans. Thanks, Evans, for that elaborate bug feature release. So just something to note, which is very important. After we have successfully upgraded the site to TaifaCare version, when doing registration, there's something that we will be able to encounter at the facility, and I just want to bring this to your attention. So some of the facilities might encounter this error as shown on the screen, which is not really an error, but ideally, just to bring this out, is that for those sites that will have not been configured to the HIE credentials, you will not be able to pull data from HIE, and for such, you will be able to see this error message highlighted on your machine, or rather on your user interface. So don't panic once you get this. Just reach out to your system admin. They should be able to get the correct credentials, or rather the HIE credentials, and update the server with the credentials so that you can be able to pull this information from the HIE. So in a case where the facility hasn't been able to get credentials, this should not stop you from providing services for the patients. You can be able to proceed and click continue to chat, and you should be able to provide services to the patient. Yeah. Next. Yeah. So allow me to proceed on the DWAPI updates. So for DWAPI, we just want to share some good news that we've been able to enhance DWAPI to push some of the indicators that were missing before, and some of the indicators that we have are on the new revised tools, which initially were not being pushed to the National Data Warehouse. But with this new release, we should be able to now push the new revised tools indicators to the National Data Warehouse, and also something that has been added on the DWAPI again is the transmission of the VMMC indicator again to the National Data Warehouse. You should be able to see this. And then another component as well is the transmission of the case management IIT intervention, and also case management home visit checklist indicators to the National Data Warehouse. Next slide. Yeah, so at a glance, just to show what we're talking about. So initially, once you've logged into DWAPI, you could see only the 5 dockets, but now you can see there's an additional dockets highlighted, the VMMC services, and some of the indicators that we'll be pushing to the National Data Warehouse are as showcased here: the VMMC enrollment, VMMC discontinuation, VMMC procedure, follow-up visit, and the MHPE indicator, which will be able now to be pushed to the National Data Warehouse and made accessible. Next slide. Just to showcase as well is the case management intervention and visit checklist and the IIT. So once you at a glance, if you now load your care and treatment docket, you should be able to see these additional indicators as highlighted. So we have the case management visit checklists, and we also have the case management IIT interventions, which have now been added and will be successfully pushed to the National Data Warehouse. Yeah, thanks, Eric. And you can move to the next slide. Yeah, so another aspect basically are the interventions. As you can see, once you navigate to the care treatment dashboard, you move to the lower section whereby you can be able to see the case management IIT interventions, or rather the case management IIT intervention evaluation summary. So you can be able to see at a glance the kind of intervention that is offered, the appointment, reminder methods, if enrolled in Shauri or not. So these are some of the indicators that should be able, or rather you should be able to push to the National Data Warehouse, and you can access them from the National Data Warehouse as well. Next slide. Yeah, so thanks. So I will pause there and invite my next colleague, who is Agnes, to take us through the second session, which is on the real-time surveillance dashboard. Over to you, Agnes, and welcome.
Thank you and good afternoon, everyone. So my name is Agnes, and I will be taking you through the case surveillance products that have been developed and will be going out with this release. We have 2 sets of products. The first set is at the facility level, and the second set is at the above site level. So at the facility level, we have a case surveillance facility dashboard, and this provides real-time data for 6 key indicators for case surveillance. So as you can see, the 6 selected indicators are HIV positive not linked, high risk negative PBFW that have not been enrolled on PrEP, those with high viral load and have not received any EAC within 2 weeks. We have the missed opportunities in viral load testing, the HAY 6 to 8 weeks without a DNA PCR, and finally the hey 24 months old without a documented final outcome. So the purpose for this dashboard is to automatically highlight the performance gaps using a color-coded threshold system. So we have a 5% set threshold such that once a gap exceeds 5%, you will see the color code red, which indicates that it's a critical gap and that requires attention. And when we are doing so well, we have the color code green that shows that we are doing fairly well. And then we have a third color code, which is the orange, which tells us that we need to moderately look at the indicator for it not to become a gap. And this will enable the users to monitor the gaps as they emerge and respond promptly to the gaps. And then the user will be able to see the patient level line list for the indicators at the clinical action report and the reporting module in KenyaEMR. And these will take the users will be able to access a list of patients associated with the highlighted gaps and then take targeted actions towards addressing the gaps. Next slide, please. Again, at the facility level, we have progress tracker. Number one, we show the facility how the trend has been on selected indicators for 30 days running. The second one, we show the facility, their progress in tracking the selected indicator over time. And then there's also another chart, which is accumulative progress, that offers a clear picture of how the gaps have been addressed. For the progress tracker, all the charts will be 30 days running. Next slide, please. We have the above site products, and the first thing is that we have a national data warehouse which has been reimagined, and everybody can be able to access this data warehouse through the insights.nascop.org link. And this warehouse consists of all the data warehouse tools, and this includes the data warehouse portal, the case surveillance products, the self-service. And the reason for developing this warehouse is so as to streamline the user's experience, to bring together all data resources in one place to make it easier and faster to find insights. So for this particular presentation, we will be focusing more on the case surveillance products. Next slide, please. And some of the above site case surveillance products that have been developed include the real-time dashboards for real-time monitoring. And these dashboards will display the 6 key indicators every 24 months, and they will be highlighting the magnitude of the gaps, and this will be at the national level. The same dashboards will give prioritization to sites, and the users will be able to drill down to the facility list, and this will help them identify and prioritize sites with the most significant gaps. We have a second set of products that have been developed for this, which is the cohort tracking dashboards. And this features a longitudinal cohort dashboard for monitoring patients' outcomes and also the associated risks over time. We have another product, which is the Sentinel event pathways. And this visualizes patient journey through various Sentinel events in their care journey. And then finally, we have the geospatial hotspot maps. And this offers a dynamic analysis of HIV indicators by time, location, and population characteristics. And this will enable the users to uncover trends and patterns linked to geographic factors. We will later have a demo to see where we can have access to all this. At this point, I will invite our next presenter, Miriam.
Thank you. Good afternoon. My name is Miriam Mwangi, and I'll take us through the HIS implementation updates. It's good to note that these implementation updates represent collective efforts, measurable impact, and a shared vision to transform healthcare in Kenya. From counties hitting 100% migration to the relentless work that is still underway behind each implementation milestone, the healthcare workers and the HIS experts who are turning now this particular vision into a reality. So to start us off, let us look at the county migration updates in terms of how we have been performing on KenyaEMR upgrades or migration from 2.x to 3.x by county. So far, we have 24 counties that have already achieved 100% migration to the KenyaEMR 3.x platform. Beyond the 24 counties at full migration, another 12 are above the 95%, meaning we are on the brink of a near universal adoption. The KenyaHMIS team is actively supporting the remaining counties to be able to close the gap, ensuring that no facility is left behind. From the line graph below, we can be able to see counties ranking that has been done by migration rate, showing both our successes and where focus efforts are required. The harmonized trend on the left shows the proof of what is working, what is has been successfully implemented, and the tail to the right now show our opportunity and our priority. For the next slide, we'll be looking at the partner migration progress. Next slide, please. Whereby we have 32 service delivery partners who have now achieved 100% migration to the 3.x platform. And we can see even more impressive is that 98% of all the active EMR sites have been successfully migrated. The exciting bit still is that 8% of these facilities have gone beyond the utility of KenyaEMR for HIV care implementation to now implement KenyaEMR 3.x across all the service delivery points in a facility. So these are 186 healthcare facilities that are contributing to the 8% utilizing facility-wide EMR are the early adopters that have now fully embraced digital transformation. So continuously, we'll also be supporting the other partners to ensure that they also achieve 100% migration to the 3.x platform. This near universal adoption has also been realized through strategic partner engagements, system trainings to TOTs at the county level, at the partner level, at the facility level, and also offering technical support by the HIS partner. So of interest, it would be good for us to explore during the Q&A how we can be able to scale the other facilities to join the 8% facility-wide implementers. Next slide. So what are these priority sites that we need to focus on that are yet to transition from KenyaEMR 2.x to 3.x? So for the facilities that have fully leveraged KenyaEMR 3.x, they are not just using a HMIS system, but they have been realizing clinical impact with improvements in patient management, looking at revenue collection, improvement in waiting times through the use of service queues, the billing and finance modules, and the appointment management modules being offered by KenyaEMR 3.x, just to mention a few. They have also realized improved operational efficiency, and they have been enjoying reduced administrative workload through automated reporting. They have been able to make data-driven decisions supported by real-time dashboards that now can be able to support early detection of disease outbreaks and even efficient resource allocations. So as we celebrate the 3.x successes this far, we must address an urgent priority. That is, the 2.x platform will no longer be supported by the KenyaHMIS project. So if these particular facilities that are yet to transition to 3.x will no longer be supported, what does it mean for these facilities? What it means is that data transmission to National Data Warehouse will be disrupted, and facilities on 2.x will no longer be visible in our health reports nationally. As well, patient care coordination activities will be significantly limited. So currently we have 57 facilities remaining on 2.x across 8 partners, contributing to around 3% of their active sites on EMR. And looking at now for the specific partner sites, the 46 sites supported by the partners, the call to action or the action plan we have is that we intend to work directly with the implementing partners to accelerate migration to these 56 facilities. For the unsupported facilities, the 11 sites coming from 9 counties, our Kenya HMIS service desk team will be in position to provide direct transition support. And we hope that no facility will be left behind is the main message. And we advocate for priority onboarding and training for these 57 facilities to transition quickly within the quarter. So we have over the years built a comprehensive and always available support ecosystem that provides sustainable expertise that we need to look at in the next slide. Next slide, please. So our aim is to transform each and every KenyaEMR user to a very confident and competent user. And we do this by providing an ever-evolving capacity building resources, whereby we continuously update and maintain step-by-step implementation guides, current SOPs to all the supported HIS solutions, and version-specific reference materials. We are implementing these evolving resources through the use of multiple learning formats, such as written manuals and guides that are available via the Kenya HMIS knowledge base website. We have a link for the Kenya HMIS resources, and as well as stepwise tutorial videos provided in our YouTube channel, the Palladium Kenya HMIS channel. And we also offer quick reference job aids as task masks for key modular navigational steps. So all these resources provide self-service, self-led empowerment, and we can be able to access, share the links, and subscribe to the YouTube channel. Recently, we have also introduced the new Community of Practice Forum that supports collective expertise sharing. And this is done through peer-to-peer learning with documented solutions, crowdsourced, validated troubleshooting pathways, expert-vetted answers to recurring challenges, and access to FAQs that are available in the link shared for the community Kenya HMIS link for the forum. Next slide, please. So here we are looking at celebrating both our progress and envisioning to accelerate impact. And we need to do this looking at some of the highlights where some of the activities we had within the last period. Since the last KenyaEMR release, the project has continued to support the counties, the SDPs, the facilities to be able to adopt and implement the HIS solutions, out of which we've been able to realize 32 SDPs supporting 24 counties to achieve 100% migration of KenyaEMR to KenyaEMR 3.x platform. We have also been able to provide continuous technical support through our service desk support team to KenyaEMR TOTs at all the 3 levels, the county, the partner, and the facility level. And as well, the HIS team have also been involved in reviewing the KenyaEMR resources content that is hosted in the Kenya HMIS website on a continuous basis so that we can have the most current SOPs and user guides. Recently, we were able to organize and coordinate a successful user acceptance testing for this particular upcoming version, the KenyaEMR TaifaCare maiden version. So for the next period that we're looking at post upgrade to this particular version, what are some of the upcoming activities that we can be able to look forward to? So we have one, we intend to support the counties and the service delivery partners through our cascaded approach of mentoring the EMR TOTs to be able to upgrade to the most current version, KenyaEMR 19.2 TaifaCare version. We also intend to conduct trainings to the county teams on the new case surveillance dashboards so that they can be able to interpret the data and be able to make impactful action decisions based on the dashboards review. We also look forward to support initially 25 counties in the initial phase to be able to leg stream the case surveillance data, as well as within the quarter. Within this particular period, we're also planning to facilitate a technical training for expert HIS personnel, more so on the new enhancements, the new changes that have been provided for in the TaifaCare version that is being released. We also will collaborate with different teams to be able to upgrade now the KenyaEMR user resources to be able to fit the particular changes and enhancements that will be provided by this particular TaifaCare KenyaEMR version, both for the SOPs, the manuals, and the video tutorials. So currently the Kenya HMIS team offers a guaranteed and efficient service desk support to the system end users that we'll be looking at the next slide. So here we are able to provide HIS user support by providing remote user support to our teams on the ground, whereby we support both the technical issues that our users are able to give to our teams. And at the same time, we are able to provide or offer what we call hands-on training sessions, where we make sure we capacity build the TOTs at the MOH level, at the SDP and facility levels. So how does this support, how is this particular support offered? It is offered through multiple channels. One of them being a free, a toll-free dedicated help desk line that is at no cost to the user, incurred by the user. Also providing a dedicated email for ticketing issues that is tracked for accountability and issues resolution, as well as providing now a comprehensive integrated online resources hub, what we call now the knowledge base for the guides and the SOPs and the tutorial videos, as shown on the service desk contacts. So for our users currently, we encourage you to visit the Community of Practice website, pose your questions, review the particular FAQs and the posted solutions, and support in contributing to the Community of Practice agenda. As we come to an end of this particular implementation updates, as the HMIS, Kenya HMIS community, we are ready with the resources to support the transition to TaifaCare version. And we believe that with technology advancement in healthcare, we will be able to touch more lives faster. So for this, all we've been talking about, myself and the previous presenters, seeing is believing. So next up, we move to the exciting session where we are going to have a demonstration of now what is this new changes, the excitement that is coming in with the TaifaCare version. And for this, I'm going to welcome the next presenter. Welcome, Eric.
Thank you, Miriam, for that update. So allow me to move away from the slides and now get to the real work that has been done. TaifaCare, powered by KenyaEMR, to showcase or do a demo on modules of mostly showcasing Rajab and Evans.
Eric, you may need to check your network.
TaifaCare version. So I'm sure you saw these when yes, you can. Rajab, confirm. If
Eric, you may need to check your network. I don't know whether it's me or because you're breaking. There's some vibrations from your end. Or the rest of the team can hear him. Rajab, confirm if you can hear Eric.
Yes, Sangok, he's breaking.
Yeah.
Just a minute, I changed my connection. Okay, Rajab, now confirm whether you can hear me.
Loud and clear.
Okay. And sorry for those who I lost. I think I'm even able to see some messages from the facilities, some confirming they can hear me. But for those who couldn't hear me, I'm sorry for that. So let me again start over. I'll be taking you through some of the features that have been developed in the TaifaCare powered by KenyaEMR, and mostly what Rajab and Evans talked about. And to start with, it's the rebranding of the login page. There before, this is not we used to see, but now you can be able to see the TaifaCare brand there. And at the bottom, powered by KenyaEMR, which is a distribution of OpenMRS. We're going to use, once we upgrade, just to use the normal login credentials that you are currently using at the facility level. So allow me to use the credentials to log in. Once you log in, it takes you to this particular section on the home page for the TaifaCare with some metrics. So what is the first thing that I want to showcase? Sorry, and to change to my using my phone, and someone was trying to call me, and sorry for that. So the integration with the HI that has been done, and for you to start with this, I'll take one of the use cases. When a patient walks into the facility and we need to offer services to this particular patient, there before you know, we were redirected to adding that patient to the system. And that is what we call the registration process. Now, with the integration with the HI, you just only need to, once the facility has been configured in that has been done, you just need to navigate to where we have the search patient and using the ID number. So for example, I may use my ID number for this use case. You can use the ID number and then click on the search. The system redirects you to selecting the identifier type. This number that I've used here to search, I need now to mention that is a national ID number, but we have other identifier types that we can be able to specify which are they. Are they the birth certificate number, which now should be used for those who are below 18 years of age, or maybe the alien ID number or the refugee ID number. So mine that I've used, it's the national ID number. And once you click on that, now the TaifaCare powered by KenyaEMR will now be able to communicate or to retrieve this information through the HIE, and then you'll be able to see the patient information, and then you can be able to proceed. And how do I proceed from here? Even if this particular patient never existed in this particular system or this particular TaifaCare powered by KenyaEMR, I don't need to go and do registration. I just need to search using the number, and then I can request for the OTP. And this is what Rajab was talking about in terms of the security, because we need now the patient to authorize for you as a healthcare worker to be able now to offer services and even be able to retrieve information pertaining to this particular patient. So once you request, OTP will be sent. So I have received it, 03918. Then once you key in that, and then you can be able to continue to chat. Remember, this OTP will be sent to the patient, who will now give you the OTP as a sign of consenting that you can be able to access the information pertaining to that particular patient. And once you do that, then you'll be able to, the system will navigate you direct to the patient homepage. So this is now making it easier. Unlike how we used to have the registration form, filling all those fields, the demographics, now with the HIE, once you start using the ID number, you'll now be able to pull these and you can be able to proceed and offer services. This is one use case for a patient who was never existing in that particular system. The second use case that I want to demonstrate, it's whereby I know we've been using KenyaEMR in the facilities. What we are going to do, it is the same KenyaEMR which will be upgraded to TaifaCare powered by KenyaEMR, meaning that you can be able to still come and navigate to search for an existing patient. So let me use a different one with existing in this particular sub and be able to see what happens when I try to search for this particular patient. So when I search, you'll be able to see this is the patient who was there before we migrated or we upgraded to the TaifaCare version. So when you search and then you click on the name, the system will be able to show you the local patient. This is the patient that we had taken there before, and then you'll be able to see now the current names or the current details that we can be able to pull from the HIE. That's the reason as we can be able to see we have the local patient and then the HIE patient. When you look at these two, you'll be able to notice that the name used locally and the name that we are pulling from the HIE, they are different. And once you verify using even the ID, because the patient may be having the ID there, you'll be able to see this information coming from the HIE. And if you agree with the information, then you'll be able to see here, it is showing you the difference, the differences that were found. And below here, it can be able to show you where the differences. One, it's the name. Here we have Wilson. On this other side, we have Ibrahim. So if you happen to, let me minimize this so that you can be able to see the buttons for the action. So once you verify and agree that this is the real names with the real information, then you can continue and you can sync and continue to chat. So sync and continue to chat, what does the system do? It picks the information from the HIE and replaces with whatever you earn. So that now you can be able to proceed with the real information from the HIE. And this helps when it comes to share claims. And that when you do that, now you'll be able to have a successful claims because these systems are validating the information coming from the EMR to the one that exists within the HIE, and then you can be able to have a successful claim. Then we have proceed to patient chat. When do we use proceed to patient chat? This is where I have an existing patient, and I know there before. Allow me to give an example. We used to verify patient, and most so the ones who are coming for the HIV services, getting the ID numbers and assigning them with a unique patient identifier there before. So there are some times whereby we saw someone and given an ID number that does not belong to that particular patient. So with the HIE, because it will be pulling your real the information from the HIE, it will be able now to show you the differences. If you feel that even the information that you pulled or the ID number that was used for this particular patient, because this is the ID number that will be verifying, it's not the right ID, and you would want to change or to edit this ID number to give the right ID number for Wilson, that is the time now you need to proceed to patient chat so that the system can allow you to access Wilson's chat or the patient chat, and then you can be able to edit and assign the right ID number, and then you can again redo pulling of the information, and then you sync and continue with the right information. So that is the time when we use the proceed to patient chat. Cancel it whereby maybe you were searching user ID number and then you notice that I used totally a different or wrong ID number, and I don't need to proceed with either proceed or sync and continue. That is when we can be able to cancel. So for my case, I just want to use the sync and continue chat to be able to appreciate the TaifaCare powered by KenyaEMR through the integrations that have taken place using the HIE, and be able to see the name here was Wilson. These are some of the information, and this is not the right information that we want to pull. What is matching here, you can be able to see it's the ID number. The ID number used by this particular Wilson and the one which is here, they are the same. This means when Wilson came here earlier, he had given a totally different name. So when I click on the sync and continue, the system automatically takes me to the patient homepage, and you can be able to see the names have changed, and even these other identifiers. So those are the two ways that we can be able to encounter while using TaifaCare powered by KenyaEMR. So the next thing, allow me to get back and talk about for you to be able to submit a successful claim, we are laid down standard that we need to have achieved for us to be able to have a successful claim. So number one, we need to have this claim. It's a certified or a real provider who was who is submitting this claim. And for us to be able to do that, we have reworked, or now we are going to reassign for the login credentials. So when you log in as an admin, because we have those administrators, we've given task them to be assigning login credentials for the users. Once you log in using that particular account, then you can navigate to the top right where we have the KenyaEMR modules. And then you navigate and you can even search for the administration. You'll be able to see this administration. Once you click on it, you'll be able to see all the users here. So even if you upgrade from the current version that you have to this TaifaCare powered by KenyaEMR version, you'll be able to see all your users at this particular page. So what are we requested to do? So within this this particular page, remember we are doing this so that we can be able to make a successful claim. We need, if you are assigning a new user, we'll start by clicking on the add user. Then you'll need to specify the identifier type, because these particular steps, the system has been integrated with health worker registry verification. And this is where it can be able to pull your information from your various registration bodies. And then it can be able to reuse that information. And that is being done to eliminate the so-called quirks, and that can be able to have a successful SHA claims, which will be reimbursed once we do the claim. So how is this one happening? Again, you need to specify the identifier identification type. We have the three of them. One, we have the national ID number. This is the national ID number IDs that we use. Then the registration number. This is the number that you're given by your body once you register. And then the passport number. Basically, you can even use your passport to even drive the national ID number. Let me use the national ID number, and then I key in a number. So once you key in the number, you can be able to search. So what the system, it's pulling data from the health worker registry. So it will be able to pull information from the HIA, and you'll be able to see the information for the particular user that you want to create or to become a provider within this particular facility. So this is the information that you'll be able to see. You can either cancel if this is not the right information, and then check again on the ID that you used. If it is the right information, then you can click on the use values, whereby the system will be able to auto update the demographic information and any other sections that we pulled from the HIE. So you'll not be required to enter all these, just only specify gender. Then you can be able to give you can be able to give the username, again assign password, then confirm that particular password. Then you can be able to force this password change. What basically this means is that when this particular user, whom I'm calling Asha, once I have created and I give her the username and the password, and she wants to log in, the system will require Asha to first change the password. And this is to ensure that there is that confidentiality, even the use of the passwords, to only the provider, so that when we want to track any transaction that took place in this particular system, we'll be able to know you are the only person who is managing your password. Then from there, these are the provider details that we pulled. You can be able even to see the provider unique identifier that we pulled from the HIE, and which is even used when it comes to claiming. Then I need to make this provider, this user provider, and then from there, getting to the roles. This is the new way how you can be able now to assign the right roles to this particular user. So allow me to give that particular user as a doctor. Then once you do that, you can save and close. Here you don't need to select unnecessary roles, just only select the role that pertains to that particular user. Then once you save, you will have updated that, and you will be able to see the last user here. It is our user there, whom we've now created. You can be able to expand and be able to see some of the information that is we're pulling from the SHA. What about for the existing ones? And we want to link or to pull the some of the information from the SHA so that they can be able to make a successful claim. What should we be able to do? So start by searching for the user. So for example, let me say this is the user. Then navigate to where we have the actions, the 3 buttons under the options there. Then you can be able to edit this user. So when you edit, the first thing is to just repeat what I did, pick the identification type, then use the identifier number. This is not the ID number, or if you pick the national ID number, if you pick the registration number, then you specify the registration number here under the identifier number. Then you search again, it will pull for you. And then once you use, it will be able now to update. Just navigate to the role section, and then you can be able to save and close. You'll have updated that particular user. The other thing that you'll be able to see, and this is something that will be done, what Rajab talked about, for a facility to be able even to pull from the HIE. Once the configurations have been done, you can navigate to the same page here. On your left, you'll be able to see the manage users. That is where we were. Then we have the last one, which is the facility details. Here you'll be able to see some of the details for this particular facility. So once configured, you can synchronize with HI so that you can be able to see the SHA information pertaining to this particular facility. And you'll be able to see the facility name, the CAF level, the SHA information, these are the side, registry code, license number, SHA status, whether this facility has been SHA contracted. And with these, once it is status and you can be able to see it is SHA contracted, it means that this particular facility can be able to make a successful claim, SHA claim, which can, will be again be paid. Then from there, moving away from that, let me get back to the patient that I created. There is another thing that I want now to talk about. It's on how do we start service with TaifaCare powered by KenyaEMR. Initially, I know we were used to, once we search, we had the patient homepage. We used to navigate at the top right here where my cursor is, and you could be able to see check-in from here. Right now, we'll not be able to see there. You need to click under the actions where my cursor is at the top right. Once you click on the actions, that is when you'll be able to see the check-in button. And this is where we'll need now to start our service, our visit. So when you click on the check-in, Evans talked about this. We'll be able to see the visit type. New, it's for those who are making a real visit right now. It's real time. We are recording as we are attending to our patient. Ongoing, I don't want to take time on ongoing. I know, again, Evans talked about it. Maybe it is today's visit, but at some time there was interruption. Getting back to this particular patient, you don't want to start another one. You click on the ongoing, then you proceed. I want to talk about or to demonstrate on the in the past, because this is one of enhancement or that I know we requested for. And where does it help in the past? This is when we want to do retrospective data entry. And I know most of our facilities for programming various programs, and maybe to mention the HIV programmings, sometimes we find ourselves in scenarios whereby we need to do retrospective data entry. In Tridotex for the TaifaCare powered by KenyaEMR, how do we go about it? So when you click on the start visit, click on the in the past, then specify the visit start and end date when that particular visit happened. So allow me to go back to 7th of May 2025. That is the start date. And then the end date, which was within the same date. Then I can change. Let's say it took 8 minutes. So once you specify this, which is very much important, the reason as to why we are doing this, we want now to create an encounter which we can be able to tie services to for this particular date. So that's the reason as to why we need to specify it is in the past, the start date and the end date. And then it was an outpatient type. And because I said I just want to use a demo, let me pick this for this purpose of demonstrating. I don't need to use queue because I'm doing a retrospective data entry. So queues may not be used this for this particular use case. Then I'll start a visit. So once I start a visit, when I get now to my forms, so I need to start again on the dates. To specify that it has an active. Okay, sorry, it has already started a visit. So once I start, I now want to navigate to the where we have the forms. So even before you fill, you can be able to see the visit that we created. So we need to select it so that we can be able, once we fill or we offer any service, it will be now tied to the 7th May 2025. So once I do that, we'll be able to see it here, adding to. Adding to means that any service that we're going to offer, any form that we're going to fill, now it will be tied to 7th May. So for you, if you are doing RDA, let us be very keen here. Even before we fill any form, we look at where are we adding to which particular encounter, because we may even have picked in the past, but when coming to the adding to, we need now to change and then need to set the date there. So allow me to pick this one, the TB screening. I'm only doing this so that I can be able to show you that it's tying to that particular encounter that we created. Then need to save. So when I navigate to the visits, all the encounters, I'll be able to see on 7th May 2025, this is when I can now be able to do successful RD in the system. So again, to what Evans talked about, I want to demo the last one on the lab. So if it is viral load, then you click on the order form. You need to specify the order date here. And the beauty is that the system won't allow you to pick any other date apart from now the date that we specified, 7th May 2025. You can give the order reason. Again, there's another section that you'll be able to see changes on the reasons have been revised. And then I can be able to save that. And when I get to clinical consultation, I expand that, get to the orders, I'll be able to see my order. It was done on 7th May 2025. And because it's RD, I can navigate to options here and add results. Let me just use 150 copies, and then the system will have updated. And when you get to your results, you'll be able to see your viral load here, 7th May 2025 HIV viral load. Results being 150 copies. So you can be able to see that it's very well doing the retrospective data entry. Thank you. Allow me to hand it over to Agnes.
Thank you, Eric. Allow me to share my screen. And in the meantime, for the case surveillance demo, I will be taking you through the access. And then at a later date, we will have a deep dive into all the products that have been developed for case surveillance. Confirm that you can see my screen.
Yes, you can proceed. We can be able to see.
Okay, thank you. So at the facility level, we have the facility level case surveillance dashboard. So for access, first you have to log in using the given credentials for KenyaEMR, and then click on the KenyaEMR modules icon, go to the facility dashboard, and here you will be able to see all the surveillance dashboards. The first one will show you the real-time gap review for the 6 indicators as I had taken you through earlier. And then we have the progress tracker that shows you the trend of the selected gap. We have an indicator filter here. And then how the progress has been in addressing the selected gap on a daily basis and then cumulatively. And this is for 30 days running. I also mentioned that at the facility level, you will be able to see the respective patients, the patient level line list for the highlighted gaps. And this will be through the clinical action report. So how to access the clinical action report, click on the KenyaEMR modules icon, go to the KenyaEMR home, and then as that runs, I had already gone to the clinical action report, and I believe everybody knows how to get there. Then you get to the clinical action report. You request a report for whichever period that you'd like to look for, and then we will use the recent clinical action report that had been pulled. Click on view, and then you're able to see to drill down to the patients that need different interventions. And the good thing with the CAR report is that it's not only limited to the 6 indicators that I had mentioned earlier. And at the website, I had mentioned that you access it through the insights.nascop. Insights.nascop.org. And this will be your landing page. So first, it gives you an overview of how the National Data Warehouse is, the number of facilities, the counties and partners supporting, and the period where the data has been pushed to the National Data Warehouse. And then when you scroll down, you have access to the various information products that are available in the National Data Warehouse. This is the National Data Warehouse portal. We have some geospatial intelligence maps. We have the self-service analytics portal. And then finally, we have the case surveillance dashboards. So for the National Data Warehouse portal is the one we are used to and that we use almost on a daily basis. And for this showcase, we will look at the HIV case surveillance dashboards that have been developed. Once you click on the HIV case surveillance dashboards, you will be taken to this login page that will require you to use the self-service credentials that had been given to you previously. And for the new users, you will have to register in order for you to access it. And then at above site, we have several products that have been developed. The first one is the real-time dashboards, and this is refreshed every 24 hours, as I had highlighted earlier. Next, we have the hotspot maps, looking through the 6 indicators to see where the gaps are rampant for targeted interventions. The third one is the Sentinel events pathway, where we look at the patients from when they become a case all the way to their final outcomes, whether they have been retained or not. And then finally, we have the cohort dashboards. We have the cohort dashboards that show the how patient outcomes across their treatment continuum and also their associated risks. So once you have registered or logged in using your self-service credentials, you can have a look at all the products that have been developed for case surveillance. Thank you, and over to you, Bernard.
Thanks, Agnes. I guess I can take it up from this point. We are a minute past the top of the hour. We still have one slide, the call to action to go through. and I think we've been able to respond to most of the questions that were raised during the presentation period. And I want to appreciate the team, of course, starting with Dr. Jacob. I think I've seen you've been able to respond to some of the concerns, Kezia, Rajab, Cosmas, and all the other team members. But first and foremost, let me appreciate the work that has been done, of course, in collaboration with all of us, and Rajab and Evans for taking us through the first purchased, focusing on the highlights of the release, and of course just detailing on what are the components that are available, what are the shared utilities that are available. Evans taking us through the bug fixing, because that is very, very, very key, and of course just highlighting on issues around how to go about fixing some of those bugs that are likely to arise, and of course just taking a step to look at the TaifaCare features, the user roles, and all that, which is very key in managing administratively at the facility level. Agnes and Marianne taking us through the data that is, the national data warehouse, and of course the announcements that have been made, and focusing majorly on the importance of us upgrading from 2.x to 3.x, because it means if you haven't upgraded your site, then it means you will not enjoy the feasibility in terms of making sure that your data is made available at the national level for use and of course for monitoring the program. So I think this is a point that we need to emphasize and ensure that we upgrade all our sites. The other comment that I needed to make, I know Evans talked about some of the models that we use at the facility level in terms of dispensing, and he mentioned about FIFO, fast in, fast out. But I think if you go to other sites, sometimes they, depending on the shelf life of any drug, sometimes they also look at expiry dates. So there could be a possibility that there are some drugs that have been in store and they were brought much later, and some have been brought in and they have short expiry. I think the guidance from the commodity team is that sometimes you may also look at what we call FIFO, fast expiry, fast out, because if sometimes you just stick on FIFO, you may end up again being left with the drugs that have expired within your store. So I think the commodity team also are encouraged to just keep checking on expiry dates of those drugs. So as they dispense what came in early, they also look at the expiry dates. So I think those are the comments that I can just make to, I wanted to make to highlight that presentation, but I want to allow only two burning questions, so that we can close, because we're already 5 minutes past the top of the hour. In case there are any questions, two burning ones, we can allow you to verbalize those questions. And then I will request Rosa Yugi, my colleague from NASCOP, to take us through the last slide, call to action. Then we close. I am not seeing any hand up, so that clearly tells me that all the questions were responded to. I want to also mention that we may not at times exhaustively respond to all the questions on some of these calls. However, I'll request Philemon or Otieno, because I know Ogutu is not in, to post the toll-free line, the toll-free number, of course, and the email addresses, where you can be able to reach out to the service desk, who are always available to support in instances where you have any challenges. So kindly just reach out to them. Thanks. I think that has already been posted, the toll-free line and the help desk email address, and of course the other portals that are available, and the other resources, the links to the resources that we do have in terms of responding to our concerns. Douglas, I think I'd seen your hand up. We can Probably Otieno, you can give Douglas the mic to ask his question. And I guess that's the only one we have. Then after that, I'll usher in Rose to take us through the call to action. Then I think we should be able to close. Douglas, Otieno, you can give him the mic. Douglas, go ahead and ask your question. Douglas, you have the mic.
Okay, Bernard, am I audible?
Yes, you are. Go ahead, ask your question, please.
Actually, sorry, I joined in late. I just wanted to consult about the upgrade process. You know, I didn't catch the bit. I don't know if you touched about it. So is it a normal upgrade, or is there any extra thing that you need to do while upgrading from the 19.1.4 to this TaifaCare?
All right, thank you, Douglas. I know we shared some communication and step-by-step process on how to carry out the upgrade, and I think it just follows the same processes that we do follow when conducting previous upgrades. But maybe Otieno, 1 minute, if you can comment, Bernard.
Yeah, thanks, Oguk. I have already posted the link to the upgrade process. I think it's a direct, straightforward kind of a process. So for the users or for the system admins that have challenges, please reach us at our service desk through the provided contacts. Thanks.
Right, thank you very much. Kindly, Eric, you can continue project the slide on call to action. And then I will request Ross to quickly walk us through that as we close. Ross, I guess you still have the mic. You kindly go ahead to take us through the... Yeah, you still have the mic, Ross, so you should be able to unmute and go ahead. Oh, it seems you are dropped. Okay. Otieno, kindly sort out Rose. She doesn't seem to have the mic, so kindly allow her to speak.
Yes, thank you, Songok. You can hear me?
Yes, loud and clear, Rose. Go ahead.
Okay, thanks a lot. That was really a flavored version of TaifaCare, and we really do appreciate the Palladium team for taking us through that. And it was a very interactive session, and we appreciate the participants who were able to ask questions, and also the entire Palladium team who have been able to really ably present and also respond effectively to the questions. I have one slide that I would like to present, and this is the slide, of course. And before that, I just want to mention that with support from Palladium, we have been able to train TOTs at the county level and also at the facility level. And so with the next plan and the call to action, the TOTs who've been trained at a county and the facility level should really able to provide the much expected support. We have 4 aspects of the call to action. One of them is that orientation of CHMTs on TaifaCare, on health administrative and integration, including the SHA claim services, should be done in the new version, just as it has been presented. It is important that we train the CHMT, or the CHMT understand the new features, so that they can also be able to support the providers effectively, and of course also utilize the system to get their data for decision making, as well as the dashboards that have been presented. Training of providers needs to be done, and we call upon the partners, county team, especially the SI teams, both county and partners, to take lead in training the providers on TaifaCare, especially the features that have been presented in this meeting. And we are happy that this particular version of TaifaCare is actually integrating with the other national initiatives. That is SHA, and also universal healthcare in our facilities. The next step is, of course, after the orientations and making sure that we have the capacities to implement, the systems need to be upgraded. And we are calling upon, again, the partners, HIS teams, to take lead on this upgrade, and especially the partners who've been trained by the Palladium team to take lead on upgrading the systems within a month to enable users to offer services on an integrated manner. And of course, with the capacity building, then a system that is a capacity that is not utilized, then of course we tend to forget. So as the capacity buildings are continuing, we really hope that systems in our facilities will be able to all be upgraded. And of course, with the trained TOTs at facility levels, we really expect you to play a key role in also guiding in the OJTs in your respective jurisdictions. Lastly, use of surveillance dashboards. The county surveillance teams are called upon to utilize the new surveillance dashboard in the National Data Warehouse to support decision-making, mainly in disease monitoring and response on the same. So those are the 4 key aspects of our call to action, and we are really looking forward to all stakeholders, key players, to take up their roles so that we are able to see these implemented as soon as possible. I hope within the next 1 or 2 months, we should have all the features presented, the upgrades, really done at facility levels. So with that, I think I won't take much more of your time, but just to appreciate all who are able to make this particular session happen, and also to thank the NASCOP leadership in supporting really this process. Without them, I don't think we would have been able to also reach here. So with that, Songok, allow me to give you back the mic. Thank you very much.
Thank you. Thank you very much. Thank you very much, Ross, for taking us through that last slide deck. This is very, very important for us. And I think, like Ross has put it, for me, I feel like the 2 months that you've indicated is even long. We're expecting that by next week, we should be the upgrade should be done, because it's a very seamless and easy process. It's not really very technical. However, for the teams that have challenges, they can always reach out to the service desk team. And the reason why I'm saying that we really need to fast track this process is because, remember, for the surveillance and public health response, there are counties that were selected or were selected to be able to conduct or implement public health response with the indicators that we've mentioned. That doesn't mean that the other counties shouldn't. So I think for me, this should be prioritized, and the expectation is that we should be able to conduct our upgrades as soon as possible, right from today or even tomorrow, and such that by Monday, the 10 counties that were selected for case surveillance should be able to access their data in the national data warehouse and be able to respond based on the gaps that they will identify. Thanks. I can see the ribbon has already been cut. Rose, this should have been your honors. You should have declared the launch, but it's okay. I can see Otieno has already cut the ribbon. We are only missing champagne, but Otieno should be able to organize for that. So at this point, I think we've come to the end of our virtual training. Of course, like I said, we are still available to provide remote support. There are trainings that have been lined up. Otieno, I think, had mentioned that. Some may be physical. The various teams will be reached out to, so that we can plan to again just continue building the capacity of all of us and in either the managerial level or even at the facility level. So at this point, I don't know whether we still have the Casco to just make some quick remarks. Dixon, some quick remarks as we close. Then Dr. Jacob, then Rose, maybe just one word to close for us. So Dixon, I don't know that you're still in the call. And I'm not sure whether Dr. Sashi was able to join. Dixon, are you still in the call? Probably he may have stopped. He may have dropped, sorry. So maybe allow me to call upon Dr. Jacob, just 1 minute or two, Doc, as we close. Then Rose will finally close for us. Dr. Jacob? Oh, he also dropped. I thought he was still in. Let me just check. Dr. Jacob, if you can hear me, please. I can see you're still in the call.
Yes, sorry, Songok. I had a bit of issues unmuting.
It's okay.
Yeah. Yeah. So for me, maybe I'll say the meeting had 3 categories of people. So the first is users, who are the primary beneficiaries of these features. Those who are using the HIV module only, I think the enhancements have been made for your use, but I want to just specifically emphasize the HIV case surveillance features, the real-time dashboards. The dashboards work in concert with the line list in the EMR, and it is to help you to identify your gaps early so that you can intervene. Then there is the facility-wide users. I think the integration with the HIE is a very important component, so that then you can be able to make your claims process easier, and also to serve your patient much more easily. I know the registration form will be much shorter for you, and to make life a bit more bearable, but also the e-claims process. My request is that for the partner who is supporting you and for the counties who oversee your work, please put a bit of pressure on them to avail these features for you, so that then we can help you to do this the work that is required. The second category of users is the technical staff who manage the implementations. You are responsible probably for doing the configurations to connect the EMR to the HIE, but also set it up for the facilities. We will be planning some follow-up, more targeted sensitization on how to do these configurations, so that then you can also be up and running. It is important because the future of digital health is evolving quite rapidly, and the integration with the HIE is a critical part of that implementation. And then the third set of users is, of course, the Ministry of Health and NASCOP, who look at the data and organize programs. I know for case surveillance, for example, NASCOP has planned a set of activities that require that these features are available at the front line. So I'm strongly encouraging maybe NASCOP, maybe the communication about the case surveillance activities could go early, so that partners know where to start when they are upgrading their facilities, because those sites will need these features to respond to the gaps already identified in the systems. So thank you so much, the Palladium team who have organized this meeting together with NASCOP, and the participants who have taken in the training and given us useful feedback. We look forward to engaging with you on the ground as you implement these features. Thank you, and back to you, Songok.
Thank you, Doc. You was cake. Otieno amesema wende unanunua keki. Anyway, that's on a lighter note. Thanks so much, Doc. We really appreciate the leadership that you've always provided from the Palladium end and the work that has spoken to this. And this wouldn't have been made possible without your leadership. So we really appreciate that. Rose, you can then close for us. But from my end, let me also take this opportunity to appreciate each and every one of us for finding time to attend. I think for the second or the third time we hit our maximum. We were over 100. I think the number was 1,100 and something, or almost 1,500. So we really appreciate that. It can't go without being noted. Thank you very much. So from me, thank you. Mubarikiwe sana. Over to you, Ross. You can close for us. Asanteni. Oh, it seems Rose again alinyang'anywa mic. Anyway, I think we can end it there. Asanteni sana. Feel appreciated. Have a lovely, blessed evening. Thank you very much. We can adjourn. Thank you.